And thanks everybody for joining us today. I'm Denise Savageau, and I chair the Water Planning Council's Outreach and Education Committee. And we're really pleased to present this workshop to you today. Our workshop is, I think, very timely. It's Source Water Protection Week. It's also Sustainability and Resiliency Week in Connecticut. So we're really pleased to be part of that effort as well. Our workshop today is on source water protection and emerging contaminants. And we have three great speakers for you today. And I'm going to let them introduce themselves. I'm just going to say their names quickly, and then they're going to, during their presentations, tell you a little bit about themselves. We're going to start off the presentation with an overview of the Safe Drinking Water Act and the 50th anniversary by Kyra Jacobs. Kyra is a source water protection coordinator with Region 1 EPA. Then we're going to learn a little bit about PFAS in Connecticut from Patricia Bisacky. She's a supervising analyst in the emerging contaminant unit with the Department of Public Health. And then last will be an introduction to 1-4-dioxane, an emerging contaminant from Iris Kaminski. And she's a lecturer at Yale, and she'll tell you a little bit about herself as well. So I'm going to just do a little bit of housekeeping and then turn it over to Kyra. Just a little bit of housekeeping. If you just joined us, please make sure your mic and your video is off so it won't be distracting. We will have questions that you can put in the chat at the end. And I just want to let people know that this is being live streamed with Connecticut Network is live streaming this, as well as we are recording this video. So with that housekeeping taken care of, I want to turn it over to our first speaker, Kyra Jacobs. Hi, Kyra.
Good afternoon, Denise. And I'm really excited to present today from Boston, Massachusetts, where I'm fortunate enough to serve as the EPA Region 1 Source Water Protection Coordinator, and I'm honored to be one of the speakers today. I really respect all the work that's happening in Connecticut. I am going to set my stopwatch because I am known for being a little bit loquacious, and so I will pull up my slides while I'm setting my stopwatch. Let's see, I'm going to share my screen. We all know the joys of multitasking during a Zoom presentation that's being recorded. Okay, I'm sharing my screen. Everybody see that? I'm going to start from the beginning. Okay. Denise, you guys okay? Can you see it?
Yes, good.
Okay.
Good.
Relying on Denise. Okay, again, my name is Kyra Jacobs. I work for EPA Region 1, and I have been working with the state of Connecticut drinking water program for, I think, over 20 years. And I am going to give you a little overview in 10 minutes of the work that I've done with Connecticut. And just, it's the 50th anniversary of the Safe Drinking Water Act. I was given this beautiful mug with the logo from my colleagues at the American Water Works Association a couple of weeks ago when I was in DC, and I'm really excited that we are celebrating such an important anniversary. So I was given the task of trying to talk a little bit about source water and my work in Connecticut and the 50th anniversary. So it's going to be a whirlwind tour. So what is source water protection? I think it's important to define it so we're all on the same page. I know that some people in this room virtually aren't as familiar, and we're really excited to have a lot of different partners here with us today. So just read the definition so we're all on the same page. Source water protection is a proactive approach to safeguard, maintain, or improve the quality and/or quantity of drinking water sources and their contributing areas. And that's a lot to unpack, but hopefully we'll be able to help you today. If you're not as familiar with source water protection and you don't do it every day, my job is to help 4,000 public water supplies in New England protect their drinking water. And we do that without a dedicated source of funding from Congress. We have to be very positive, optimistic, and creative. So Denise, are you, when I'm showing it, it's the bar is showing at the top. So I just want to make sure.
Yeah, no, it's fine.
Okay, perfect. So what is source water? I'll just go over this quickly. So it includes both surface water, so that's like a reservoir or a lake. Reservoirs are artificially created by a dam. Lakes, of course, are natural. So if you look, I wanted to hover over here in Connecticut. So, because I spent some time looking at this map. So we have people who are on private wells. Many people in Connecticut, especially in more rural areas, rely on private water through their private well. And you are responsible for your own private well, just like a septic system. 300 million people are using in our country 155,000 public water systems. So that's a lot. And then here in Connecticut, unlike our northern neighbors, New Hampshire, Maine, and Vermont, which relies about 40% of the population of northern New England uses private wells. Whereas in Connecticut, you can see between 71 and 80% of the population of Connecticut, which is a little more urbanized than the northern New England states, is on public water. So it's really important the work that your colleagues are doing at the Connecticut Department of Public Health, which is a remarkable job. And they work really closely and successfully with partners like those here today. As I mentioned, we're celebrating 50 years of Safe Drinking Water Act. I just am so proud to work for EPA. I just celebrated my 27-year anniversary at EPA. And, you know, the Safe Drinking Water Act is not perfect, but it is something that we can turn to and allows us, the architecture allows us a framework and structure for how to protect the nation's drinking water supply. And I won't read all this in depth because I wanted to just provide some background, but you know, it is landmark federal legislation, came 2 years after the Clean Water Act. And if we had an hour, I would talk to you about the difference between the Clean Water Act and the Safe Drinking Water Act. But just remember that the Safe Drinking Water Act does not focus on the water before it gets to the treatment plant or to the well, the municipal well, groundwater source. The Safe Drinking Water Act is truly focused on ensuring that the water meets certain parameters or criteria before it gets to you at your tap. So these are, the Safe Drinking Water Act is really focused on the back end before it gets to you. Whereas the Clean Water Act is focusing on protecting water quality in more general and improving and cleaning any water that's been impaired. So there have been many amendments. I'll just run through this in a moment. And I just want to call this to your attention. The American Water Works Association, I happened to be in their offices 2 weeks ago and met the woman who is putting together all of these resources. And so she sent me this link and I didn't even scratch the surface. There are all these terrific videos that you can link to. I'm sure we'll be talking about the fact that next week is Source Water Protection Week. So if that's not on your radar, there's some great resources you can just borrow from the American Water Works Association at that link. So here's the timeline. This is also a nice photo from Connecticut. So we had the Safe Drinking Water Act was passed in 1974. There were some important amendments in 1986. And then 1996 was a pivotal year. That's when we ended up, Congress gave us some funding that was a one-time offer. And they asked the states, the 150,000 plus drinking water supplies to create a source water assessment plan for every system in the country. So Connecticut worked diligently, tirelessly, and in 2003, that was the deadline. So every public water supply had to have a source water assessment completed. So we're looking at the threats. And the analogy I always use is, you know, like when you go to your doctor and you have a physical, what are the threats to the body of water? What are the threats? And then how are we going to mitigate those or play defense so that they don't end up impacting our water supplies? So, you know, there's common elements of the source water protection program, which is an overarching program that the state of Connecticut Department of Public Health runs, is source water assessment, stakeholder outreach and partnerships, the source water protection plan, which is not required in the state of Connecticut, and program implementation. And it has lots of different components, but includes voluntary, mandatory measures, the local, state, and federal level. We have a lot of partners, the public water systems, community leaders, land use decision makers, ag, including Connecticut Department of Ag, Connecticut NRCS, Forest Service, Forest Connecticut, DEEPS, Forestry Agency, and the public. And when we looked at the aggregate data from New England, we learned that the top threats, and generally this is still legitimate and defensible, the top threats to drinking water supplies in New England are stormwater, failing septic systems, hazardous waste, leaching from legacy sites, land use, which includes agriculture, residential lawns, conversion of forested land to developed land, and leaking underground storage tanks. So I only have a few more minutes. So I just want to stay focused on how can we together make a difference. So when we look nationally, how do we protect drinking water sources? We do it through partnerships and collaboration. We launched the National Source Water Collaborative in 2005. That's the link there. And our vision is described in the infographic there. And then in 2013, Connecticut was the second state in the country after North Carolina to create their own source water collaborative. And I'm really proud that I was part of that. EPA funded a workshop, which I believe was in December 2013. And we worked with DPH to develop a statewide collaborative, and we modeled it after the national one. We have more than 20 members. I'm sure it's grown since then. And here's some photos from our June adventure. we were with Aquarian Water. So we were at the water treatment plant, and then we were out in the field after we had our meeting. And we do these field trips and meetings to help members learn about how to protect Connecticut's drinking water supplies, because it's not a one size fits all. So if you live in Coventry, or if you live in New Haven, or if you live in, Greenwich, or if you live in East Lyme, everything, it's so different. It really depends on what's happening in your community. So of course we need water suppliers, state and federal agencies, regional planners, municipal officials, and nonprofits. And that's the link for the Connecticut Source Water Collaborative if you haven't seen it. And I went through it really quickly so that I wouldn't, impede on my other colleagues' time, but I believe we will have time for questions at the end. And this is a beautiful shot of the Easton Lake Reservoir where we were in June in Trumbull, Connecticut. And I just love what we're doing together in Connecticut. I couldn't be prouder of the work that Denise Savageau, all of her colleagues at the conservation districts, the state, I could go on and list many of them, but for those of you who live and work in Connecticut, you should be really, really proud of the fact that you have sophisticated, smart people helping you do this work and protecting your state's drinking water. So with that, I'm going to turn it back to Denise, who I believe is introducing our next speaker.
Thanks, Kyra. Much appreciated. And source water protection is so important, and there's a lot going on in Connecticut. Our next speaker, Pat, if I could ask you to unmute and come off of you, and bring your video up as well as your presentation, that would be great.
All right, do you see me?
Yeah, there you are.
Okay, good.
Pat's
And how
with the
about that?
Department of Public Health, and we'll let her take it away on emerging contaminants.
All right, hi everybody. I like Kyra, am very excited to be here. I spent quite a few years in the source protection program, and I'm really happy to see a lot of familiar names. I do miss my source protection friends, but PFAS needs a lot of attention too, and I'll describe a little bit about it today. My name is Pat Bisacky. I am a supervising environmental analyst with the Department of Public Health. My specialty is emerging contaminants, and we have a whole unit that works on emerging contaminants. And one of the focuses we have right now is PFAS, because there is a lot going on PFAS. So what I'm going to talk to you about today is I'm going to set the level set for everybody. We're going to talk a little about what are PFAS and talk about the PFAS cycle. I'll give you some resources to find data about PFAS in Connecticut. And then what we'll talk about is the most important part for source water protection is the federal and state actions to limit exposure. And then individually, how can we limit our exposure to PFAS? So what are PFAS? They are an acronym for per and polyfluoroalkyl substances. PFAS are a family of chemicals. The numbers keep on growing and growing. It's in the thousands now. I've stopped actually putting a number down because every time I give a presentation, there's more. PFOA and PFOS are the most well-studied of these PFAS. The PFAS were first developed in the 1940s and 50s, and now they're commonly used in many, many, many consumer products and in industry. And the way you identify a PFAS is they have one carbon, at least one carbon-fluorine bond. There are many different levels of PFAS. PFOA and PFOS each have 8 carbons. They are very difficult to destroy. The bond between carbon and fluorine is one of the strongest bonds known to mankind. So they were very good when they were first developed. They repel oil, grease, water, and heat, and they're very stable. What we've now found out is that they also have negative traits. They are extremely persistent in the environment, and they resist biodegradation. They're bioaccumulative, they're toxic, and they migrate easily in water and air. Some of the uses for PFAS, because they're so stable, because they repel water and heat and grease, you'll find them in rain-resistant coatings, like in raincoats and work boots. You'll find them in stain-resistant coatings, like in paints and in carpeting. Grease resistance, pizza boxes and popcorn. They are in your cosmetic products. They're in nonstick cookware. They're also in the firefighting foam that firefighters use to battle petroleum fires, called AFFF. They're used in industry. Generally, one of the main uses that they're used for is they are used in metal plating, and they coat the baths of metal platers so the people who are working there aren't exposed to metal fumes, but instead they're exposed to PFAS fumes now. A lot of car auto products, because of their resistance to staining, they put them on cars too. So with all these uses comes a lot of different ways PFAS can get into the environment. PFAS loves to travel with water. Even though it's water resistant, it likes to live on the interface between the water and the air. So you'll find all these different ways that PFAS can get into the environment. One of them I have here is the firefighting foam that's discharged into the ground. For many years, the manufacturers of firefighting foam indicated that this was a safe thing to do. So there's a lot of areas where firefighting foam has been discharged all over the country by people unknowingly discharging a toxic substance. The landfills, because of all the products that PFAS are in, and we discard them and they end up in the landfills. PFAS manufacturers also release PFAS through their wastewater and through their air emissions. All of these end up in following the water cycle. Excuse me. Biosolids that are used to treat farmland, because PFAS are in our wastewater, they end up in our biosolids coming out of the wastewater treatment plants. They get applied to the ground. They get their uptake into animals and also the vegetables that we can eat. And then they all end up in the drinking water through wells, in the surface water. And generally, public water systems do not treat for PFAS because they have not been regulated. So looking in Connecticut, PFAS are just starting to become regulated. And this is a screenshot of the EPA's PFAS analytical tools. On it, you'll see a whole bunch of dots, and those dots with colors in them represent PFAS that's detected in Connecticut. EPA has been doing a couple of different programs. One is the Unregulated Contaminant Monitoring Rule, where all public water systems that serve over 3,300 customers are testing their water for 29 PFAS. the data that comes out of that testing program is uploaded onto this map. And those are you probably can't see very well what they are, but I encourage you to go to the EPA's website and look at it. So the circles, the little circles, are the drinking water results. And you'll see that there's a lot of white circles on that map, which is good news for Connecticut. There are also a lot of circles that aren't white. And so as we go forward, as testing continues, this map is going to fill up. And, I encourage you, as I said again, to go in and look at it. There are different types of sources in here. Most of it is drinking water, but some of it is some statewide testing that's been happening, targeted testing, and also Superfund sites. And when a public water system detects PFAS through the unregulated contaminant monitoring rule, EPA is asking them to do a source water vulnerability assessment to try to find out where these PFAS may be coming from. And those sites are also on this map. So there is good news in PFAS. EPA for the longest time just hadn't done anything. And back in, I'm going to say 2021, EPA created an action plan, and they're actually following it. The first big step that we're taking for PFAS, and this is a reactive step. The EPA finalized a national primary drinking water rule for PFAS, and it was promulgated back in June. What it does is it sets enforceable limits for 6 PFAS in public drinking water. It requires public water systems to test for those PFAS and notify the customers if there are any detected. It also sets a time frame for public water systems to provide water below the enforceable limits. And it also identifies best available technology that public water systems can use to remove PFAS from drinking water. And that is also good news, that there are technologies out there that can remove it from drinking water. And I have a link here, and hopefully the slides will be shared and you'll be able to just click on these links. This is more information on the PFAS rule for you. Other actions to address PFAS from EPA. I just spoke about it. It's the nationwide occurrence monitoring for 29 PFAS. Now, EPA is regulating 6. Those are the 6 that show up the most, and there's the most information about their health effects. And so in the 5th unregulated contaminant monitoring rule, they're getting information on 29 PFAS, and those are the 29 for which there are drinking water methods available for analysis. EPA is also expanding the analytical methods for environmental media in drinking water. They've produced some wastewater methods, a surface water method, and they're working on air methods now. EPA's also updated guidance. It's interim guidance on the destruction and disposal of PFAS, because PFAS is so recalcitrant and so difficult to break apart. There's been a lot of study going into it, and there's some really super work going on in EPA at the Office of Research and Development and trying to figure out how to get rid of these PFAS once we have them. EPA has also designated certain PFAS as hazardous substances. They're requiring reporting for certain PFAS in their toxics release inventory law, and they're also finalized a significant new use rule for inactive PFAS. So some PFAS have been phased out of regular use. PFOA and PFOS are the main ones. And if somebody wanted to manufacture them again, they would have to go through a whole process through EPA to be able to use those products. And here I have also a link to EPA's PFAS strategic roadmap. Connecticut has also been taking some steps to reduce PFAS release to the environment. One of the major source water protections things that we can do is to reduce and eliminate PFAS from being sent out into the environment. Public Act 21-191 is an act concerning the use of perfluoral and polyfluoral alkyl substances in Class B firefighting foam. What it did was created a take-back program that DEEP has been administering along with the Department of emergency services and public protection for municipal fire departments to take back class AFFF foam, and also identify alternatives that fire departments can use to put out petroleum fires. It also updates the toxics and packaging law that includes limits for intentionally added PFAS in food packaging. And those requirements are being implemented very soon, I believe in the early 2025. And then recently, Public Act 24-59 is an act concerning the use of PFAS in certain products. This is providing timeframes for limiting the sale and distribution of certain product categories. I think there were about 18 with intentionally added PFAS. It adds labeling requirements for products that claim to contain intentionally added PFAS. And I do want to back up a little bit. Part of Public Act 21-191, in addition to the AFFF take-back program, it phased in a prohibition on using AFFF to discharge it to the environment. There are some exceptions there for those uses that have not been deemed acceptable, like in I believe, I'm not going to say it for sure, but use at airports was required until there was an alternative found, and then there was a couple other uses of AFFF that were exempted until an alternative is found. So how can we limit our own exposure to PFAS? The best way is to become knowledgeable about your potential sources of PFAS. And if you know your tap water contains PFAS, you may consider reducing or eliminating your use of the tap water. Become a good consumer, a wise consumer, and limit your use of products containing PFAS. And a way you can do that is avoid products that have fluoro or perfluoral in the ingredient list. And pretty much most products with water or stain-resistant treatments, non-stick coatings, and whatnot. If it says it's PFOA-free, it does not mean that it's PFAS-free, because as we talked about earlier, there are thousands of PFAS. And another thing that we can help you with at the State Department of Public Health is we do issue fish consumption advisories. There are just a very limited, because we have a limited amount of data on PFAS in fish in certain areas. There are a couple of areas in the state where there are fish consumption advisories for fish with PFAS in them. And, thank you. And I look forward to your questions. And thanks again for inviting me to participate.
Thanks, Pat. That was great. A good overview. Our next speaker, we're gonna hold questions till the end. Next speaker is Iris. I see Iris has come off, is now on camera, and unmute yourself and you can get started.
Hi, so I'm really pleased to be here, and I'll give a short introduction on 1,4-dioxane. Let me just put on my timer. So I'm with the Yale Superfund Research Center, and this is, oh, next slide, please, Kelsey. So this is my outline. What is 1,4-dioxane? Where does it come from? Should I be concerned? What can be done? And I'll talk a little bit about the Yale Superfund Research Center. Next slide. So what is 1,4-dioxane? It's an organic chlorinated solvent. It's a volatile organic compound, and it's colorless. It's very soluble in water. It doesn't degrade easily in the environment, has little affinity to soil, and it's very small, and it's suspected to cause cancer in humans. And because of these characteristics, that it's small, very soluble in water, it doesn't degrade easily. It really can go through and percolate through our ground and reach our groundwaters, just like the PFAS that were mentioned earlier. Next slide, please. So where can they be found? So in Connecticut, we have over 13 Superfund sites, and not all of them contain 1,4-dioxane, but they are a source, a known source of 1,4-dioxane in some cases. And activities of these sites can be traced back to 1851 in Durham Meadows. And they're associated with chlorinated solvent contamination, a stabilizer for TCA, and possibly other chlorinating solvents. They're in the pharmaceutical industries, laboratories, in car washes, in car wash facilities where they use concentrated soaps, and textile. They're associated with textile and dyeing of textiles, and inks and printing, and they could be found in our personal care products and in landfills. Next slide, please. So this is a map of occurrences of 1,4-dioxane from 4,800 public water systems that serve over 10,000 people. And the red dots are indicate the concentrations of over the recommended contaminant, which is over 3 ppbs, and about 7% of in 7% of these public water systems consist 1,4-dioxane was found to be over the recommended contaminant level, and in about 21% of these systems, 1,4-dioxane was detected. Next slide, please. So this is a little bit history of the production of 1,4-dioxane. It was invented in 1863. It's a synthetic chemical, and peak production was in 1985, and we could see it with a reduction so far. Next slide, please. So as mentioned earlier, this is a 1,4-dioxane. It's also an emerging chemical and a forever chemical. And we have a cycle of different pathways that it could reach our water sources through the sewage treatment plants, industrial discharge, street runoff, and landfill leaching. Next slide, please. So where does it come from? It comes mainly from industrial manufacturing, but it can also be found in our cosmetic industry, in our common household detergents and shampoos, body washes. And the reason I'm emphasizing that it's a byproduct, it's not labeled. It's not something that you could say, oh, I'm going to buy a safe hair wash for my children, and you cannot look on the list of ingredients and find it. So that's why it's also known as a hidden toxin. Next slide, please. So we have a wonderful collaboration with Citizens Campaign for the Environment on the Long Island Sound, and they've been since the EPA surveyed the United States. The Long Island Sound was found to have one of the largest concentrations of 1,4-dioxane in their water sources. And they did a lot of work since, including they tested 80 common household products by independent laboratories. And these products have the highest levels of 1,4-dioxane. And number one, the winner here is the Victoria's Secret Bombshell body wash with 17,000 parts per billion. And as Adrian Esposito from Citizens Campaign for the Environment is, now we know what's Victoria's Secret. And then I want to point out number 5 here, Draft newborn detergent with 10,000 parts per billion. and 9, which is popular wash for babies, Baby Magic, with 7,600 parts per billion. So number 3 here, Tide, the most famous, one of the most common laundry detergents, is produced by Procter and Gamble. And since Citizens Campaign for the Environment's great work, and New York has changed legislation and to regulate 1,4-dioxane, both in household products and in drinking water. And the formulation is going to, the regulation, the limit will be 1,000 parts per billion in the future. And we would enjoy hopefully we'll enjoy this legislation here in Connecticut. Next slide, please. So should I be concerned? In 1999, the International Agency for Research on Cancer classified 1,4-dioxane as Group 2B, which means that it is a possible carcinogenic. In 2023, the EPA drafted a revised risk determination, and this includes risks to workers, consumers, bystanders, the general public, and so on. Specifically, EPA identified health risk, including toxicity to the liver, adverse effects on olfactory ileum, which is related to smell, and cancer. 1,4-dioxane has known to cause organ damage. This is found through animal studies, and right now we don't have research involving humans that prove this, that prove that its impacts on humans as well. Next slide, please. So just very general, how do I know my risk? Risk includes both, you need an exposure source and you need exposure and a hazard. And so you need a hazardous at a specific concentration. And your risk factor could include your weight, like babies and kids will be maybe at higher risk. And of course you need exposure, frequency and duration. Next slide, please. So just I want to review quickly the sources and potential exposure. So as I mentioned earlier, 1,4-dioxane was detected both in surface water and groundwater. The pathways to humans include inhalation, dermal exposure, and through drinking water. And the pathways to the environment. So it's through various industries, and we can see in this small figure here, it comes from the industries, it goes to the landfill, it could leach into our surface waters and to the groundwater, or if you're a community and you use these household products, tiny amounts of it could go to your sewer system, or if you have a septic tank, these could leach and go to the groundwater and to the environment. And so just to a reminder, approximately 24% of drinking water in Connecticut is from private wells with no mandatory monitoring. Next slide, please. So just quickly, currently there is no federal regulation for 1,4-dioxane in drinking water. And in Connecticut, there is a drinking water action level for 1,4-dioxane at 3 micrograms per liter. And if you're a private well owner, the best way to know is really just to reach out to a certified laboratory and test your water. Next slide, please. So how can you limit your risk? And these are some products that are tested to be that no levels of 1,4-dioxane was found in them. And so you could be mindful about the products that you purchase. And then you could be mindful about impacting the environment and your neighbors in a case if you have, let's say if you have a septic tank, or just if you use these projects, just know that it could impact the environment down the road, because as it's a forever chemical. Educate your household, inform your community, request your legislators to act. And next slide, please. So just real briefly, the Yale Superfund Research Center has a multidisciplinary approach to understanding public health impacts on emerging contaminants in drinking water and technologies to treat contaminated water. And we have a great collaboration between public health and the engineering department. So the public health is investigating 1,4-dioxane in drinking water and potential linkages to health. And our primary site right now is the Long Island Sound in New York. And our engineering projects are working on water treatment and sensors. They're looking at cost-effective, energy-efficient technologies to sense and remove 1,4-dioxane from drinking water. And then policy change. So hopefully we have some regulators and policy people here just to educate and inform you on emerging contaminants in drinking water. And next slide. And I have 2 more slides. So this is a busy slide. This is Project 1. We look at liver cancers and biomarkers in a controlled environment with mice. The lower right side, Project 2, exposure assessment and in the Long Island side, Long Island, New York. Project 3, we're looking at novel methods for detection of 1,4-dioxane. And the upper right side, Project 4, we're looking at advanced oxidation treatment to treat for 1,4-dioxane. And last slide, please. I'm just going to end with the quote. 1,4-dioxane is more widespread a contaminant in drinking water than most other synthetic chemicals. This is by Thomas Moore, who is the author of a book on investigating and remediating 1,4-dioxane pollution. So thank you very much.
Thank you, Iris. That was great. Informing us about a new chemical that we haven't heard a lot about yet. I'm going to ask our 3 speakers to come back on camera, and we're going to take questions. We'll take questions in a couple of ways. You can put a question in the chat, and we'll monitor the chat, but also if people want to raise their hand and ask a question as people are getting ready to do that. I'm going to actually start with a question or clarification. I'm going to ask Pat. Pat, in Connecticut, we have a unique system of protection for our public drinking water supply where we don't allow for wastewater discharge into our public drinking water supply. Could you talk about that a little bit, just so that people understand, because we have some challenges with PFAS and with 1,4-dioxane, but I just want to make that clarification in terms of how our public drinking water supply works.
Yeah, so Connecticut General Statutes Section 22A-417 restricts the discharge of wastewater treatment plants and other wastewater upstream of drinking water reservoirs. So that applies only to surface water. So none of the surface water that people in Connecticut are drinking has received sewage, which is a huge it's a huge help when it comes to preventing emerging contaminants from coming into the drinking water, because every other state in the country allows that. And if you could imagine the Mississippi River, and town A is upstream of town B, it takes its water in above the town, it discharges it below the town, then town B takes the water in and then discharges it below. And then by the time it gets to New Orleans, so there's it actually saves the people of the state quite a bit of money, because to treat clean water is much easier than to treat dirty water. So this is what we have for surface water. For groundwater, the story is different. There's the Aquifer Protection Program, which restricts land uses above areas that are contribute to groundwater sources. However, many of these areas, groundwater sources existed, and also the uses existed prior to the regulation. So there's other ways that we need to do. A lot of times treatment is employed to deal with the impairments that come from land uses.
Thanks, Pat. And I also was looking at that, we talk about biosolids, and I know our neighbors and particularly a lot of farms in Maine are really dealing with this with the PFAS, but we have a history of prohibiting land application of biosolids in Connecticut. So there's a few things that we are ahead of the curve on. That said, obviously, the non-point source piece of this is really, really important. And I think to Iris's point on some of the chemicals she was talking about, 1,4-dioxane, looking at, private wells and what we see in septic systems, that's something we're really looking at. So thank you. So I'm just going to open it up to any other questions folks may have. If not, I'd actually like Kyra to come back on and talk. Kyra, I know you went really fast. So appreciative of your presentation. Could you talk a little bit more about that distinction between the Clean Water Act and the Safe Drinking Water Act? I think people don't, even though the Safe Drinking Water Act does get a little bit into source water protection, primarily, as you said, it's focused on the back end. It's once we get water into a water treatment facility and then through the pipes. Could you just talk about that a little bit more so people understand some of our challenges with source water protection, and the limitations of the Safe Drinking Water Act and why we rely on the Clean Water Act?
Sure, I'll do my best. And I know Tracy Ayad is on the line as well. So we have some experts from Connecticut Deep. And that's another distinction I just want to point out. So a third of the states in the country, the Clean Water Act program is administered through a separate agency. And that is the case in Connecticut, along with some other New England states. So the Clean Water Act and the work that is required from each state is administered through Connecticut Deep. And the Safe Drinking Water Act is administered, we call that delegated to the Connecticut Department of Public Health. So the challenge is, in both cases, actually, we have met the enemy and is ourselves. So whether you have a septic system or whether you have public water, we know that what we're doing is impacting our waterways. So I think what Denise is driving at, because we have a lot of conversations about this, the Clean Water Act has some funding. It's limited, but the Clean Water Act has some funding through the 319 non-point source program. But there's been a lot of attention in the past 15, 20 years because EPA was sued to focus on cleaning up impaired water. So that's dirtier water. So the Connecticut Deep is pressured by EPA because of our Clean Water Act requirements and the money that is given to them to clean up impaired waters and get them off what's called the 303D list. And in Connecticut, because you don't use rivers, so we're sort of like this in Connecticut because I have other states that have rivers. So we're really excited when the 319 Clean Water Act folks are busy trying to clean up impaired waters because it's going to protect our drinking water supplies. Connecticut Deep is doing what they're required to do by EPA and Congress. And their charge is to protect water quality, improve water quality, and use the tools that are provided by the Clean Water Act. The Safe Drinking Water Act, as I said, doesn't give you any true tools in your toolbox to prevent contamination. So that's why we are so reliant on our partners, which includes, municipalities themselves, one thing Denise and I talk about all the time is that especially towns that are in any of the watersheds in Connecticut, they're contributing to Long Island Sound water quality impairment. So even though the Long Island Sound program says, oh, we are a coastal program, that's not drinking water. Denise and I say, but Joe Welsh is on this call from Aquarian. Guess what? The Aquarian water supply watershed is in, the Long Island Sound watershed, so it's, we can't, Denise and I talk a lot about one water. So even though Congress created these two acts, Clean Water Act in 1972 and the Safe Drinking Water Act in 1974, and never the twain shall meet, at the end of the day, we talk about one water, because whether it's stormwater, wastewater, or drinking water, it's the same water from the same water cycle. So we in New England and in Connecticut really want all of us to start thinking about it as one water, and that, yes, we're trying to, protect the $319 so that they can be directed towards getting dirty water, impaired water cleaned up or less impaired. But at the same time, we're also trying to protect healthy waters in Connecticut. And because the Safe Drinking Water Act doesn't have grant funding to do that, we are always trying to arm wrestle with other agencies and programs to say, hey, can you direct some of your funds to protect and keep our drinking water supplies clean? Does that help, Denise?
Yeah, thanks. And I think it's important for people to understand when we're talking about source water protection, that although the Safe Drinking Water Act wanted everybody to have a source water action plan, source water protection action plan, that it was an assessment program, but the tools, the land use regulatory tools for protecting water in our watersheds comes from the Clean Water Act, comes from, planning and zoning, comes from in Connecticut, we have an Inland Wetlands and Watercourses Act. So it comes from those other regulatory programs and other programs such as, keeping forest as forest. So I think I just wanted to make sure people understood that a lot of the mandates in the Safe Drinking Water Act were not necessarily aimed at source water protection. So we have this kind of, little bit of a tension there, and that we have to rely on other pieces of legislation, the Clean Water Act, like I said, Inland Wetlands Act, some of those other ones, to help us with that non-point source pollution, that source water protection. So thanks, Kyra.
Denise, I see there's a question in the chat and you can answer that, but I also want to point out our colleague from Vermont is on this call, Laura Ranker, and a state can go one step further, which Vermont did about 30 years ago, and they can require source water protection plans. So that actually puts into statute the requirement to do a more advanced effort to protect the water supplies. So not suggesting Connecticut do that. I'm just explaining that some states have taken that next step, and
So,
Vermont is on
so
today.
Kyra, I'm going to break in, and
Mhm.
Connecticut did take that next step. We do have water supply planning
Groundwater.
requirements for the individual water supply plan. Every utility that serves over 1,000 customers or individuals has to create this water supply plan, and part of that is a source water protection plan for each of those.
Okay, good.
systems.
Good, because I can't keep up with all the states, so I never remember all the nuances.
Thanks, Kyra. And Iris, I know that you wanted to add something in on your presentation.
Just two things. So there was a question from someone if the slides will be available, and also so they will, and also how to get the list of all of the 80 products. So that is also on the slides, and you could find that on the Citizens Campaign for the Environment website. And I forgot the slide to present the slide of acknowledgements to Professor Vasilius Vasilio, our center director, to Adrienne Esposito from the Citizens Campaign for the Environment, and she's my co-leader of the community core, the community engagement core, Dr. Barbara Muzzy from Yale School of Public Health, and mainly to a real special thanks to all of our trainees. We educate graduate students, doctoral students, and postdocs that they do the research, and they really do great work. So thank you, Denise.
Yeah, thanks. And I saw someone just put in there that there's something about sludge and the forever chemicals in farms. And again, just to reiterate that we don't allow biosolids to be used on our farms in Connecticut. We are pretty stringent about certain things in Connecticut. That said, we still have these hidden contaminants, and source water protection is the way to get there. I do see Barbara. Barbara has her hand up, and this will be the last question as we wrap up for the day.
Yeah. So thank you so much. I have loved these presentations. I work with Dr. Herz Kaminski at Yale, and live in Cheshire, Connecticut, and as a resident of Cheshire, and along with studying this with my colleagues, this has all been really fascinating. So something for me that I'm finding so interesting is what we've been learning in New York State as they've implemented regulation of products around 1,4-dioxane. It has taken them really quite some time to clarify with the industrial producers of how to implement this, who's tracking it, how are the producers verifying this. That's created its own mini bureaucracy. And so I'm curious if Connecticut is putting in place the PFAS one, what process will be in place. I see that there's something has to be in place by January 2026. I'm curious about that whole implementation, because ultimately, as one of the presenters said, it's all about, at the end of the day, it's going to end up in the water somewhere, because these chemicals don't break down easily. They're all there. And this is especially the case of concern in Connecticut because of the very high percent of households on private wells. So
Right.
I guess the question is about that
Yeah.
product.
I'm going to
oversight.
give Pat just a quick minute to wrap up as we end this session. Thanks, Pat.
Yeah, so the Department of Energy and Environmental Protection is the agency that is working on that. They have a pollution prevention group that you can go onto their pollution prevention website, and they are the ones who are in the process of identifying those sources and administering those product laws.
Thank you. This has been a great conversation, everyone. Thanks again to my speakers, Kyra Jacobs from EPA, Pat Bisacky from the Department of Public Health, and Iris Kaminski from the Yale Superfund Center. This was a great conversation, really important to have. For everybody, the presentations are going to be made, and we will have shortly, the video will be on the Outreach and Education work site. So we're looking forward to that. We're going to be having another presentation on flash drought in October. Stay tuned for that. And we'll sign off for now. Thank you, everybody.